Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thank you for joining me again this week. Today, I have a guest who's been with us before, a repeat offender. Today's show, we're going to talk about geriatric care management. And if you're like me, I hear that word and I say, what is that? How does that fit into my care? What do I do with that? And should I? So today we're going to talk about all things related to geriatric care management. If you're a caregiver, if you're a son, a daughter, a spouse, a patient who is caring for a loved one, or the patient yourself, and you are over 65, please stay tuned because we have a lot of important information. And this is fairly new type of care and important. And we're going to put the pieces of the puzzle together for you. So my repeat guest is Brandy Hackett, and she is here today with Lisa Meeks, who I have known of for years in the Georgia market. And I'm so pleased to have both of you to the show. Thanks for joining me today.
Thank you for having us.
So Lisa, why don't you give a little background about who you are and what your background is before we get into what is geriatric care management?
Okay. My background is as a certified care manager. I've been certified for 10 years. And before that, I was a certified therapeutic recreation specialist, worked at Emory Hospital, and I've worked at the VA nursing home, and decided that definitely geriatrics is the focus that I want to stay with, that is the population that speaks most to me and that I wanted to serve. I came into this field, learned about care management from my mother, who is an RN, and she had a practice in Chicago, which is not where I grew up. Everyone asks me that, but that is not where I grew up. And she had a practice there with, I think, 3 or 4 care managers working for her, and she's since sold her practice and is retired. But she was so excited about entering the healthcare arena as an advocate that I wanted to see what that was about. So I went to spend time with her and shadowed her, read charts, got the paperwork. I came back here in 2001 and just took off.
And as you know, from our shows, this show is called Better Living, and it is geared towards seniors and their loved ones, and it is about all aspects of senior living. Mm-hmm. It's called Better Living. We want to help people make the right choices so that they can live the best life possible.
Absolutely.
For the rest of their lives. Mm-hmm. But one of the things that I love is that I get to interview folks that are truly dedicated and passionate to caring for this population. And that's not always the case. You know, it's not. I've known Lisa's name for years, and I know Brandy, we go back for years as well. And these two outstanding women are passionate, compassionate, dedicated women to the geriatric population. So I'm so happy to have you here today. And we are going to talk about geriatric care management because I'm still confused. Okay. There's so many different options to where to go, what to do for your health care. And with healthcare insurance changing, I have so many questions for you today. So we're going to delve into that. Okay. Brandy, can you remind our folks about your background, as diverse and as specific as it is, and I know how much expertise you have. So I want the folks to know what kind of a person we have here today with us.
Definitely. I am a master's level medically trained social worker. I have worked in lots of different arenas, including hospice, oncology. I've worked with guiding people through Medicare. I've worked in a funeral home for a year, helping people pre-coordinate services. And I actually just attained my certification as now a professional geriatric care manager. And I'm very proud to become part of this team. And it's really neat to bring the social work angle because our discipline is very specific, but yet very broad. And so, like Lisa, I've gone more into geriatrics, focused more on medical. And so it's really neat to look back and see how all of the pieces are now fitting together.
And, you know, we all work in healthcare, mm-hmm. and we've heard for a few years now, God love your mother because she was clearly ahead of the curve, Lisa. Mm-hmm. But lately, we've been hearing about how this is going to be a more and more useful type of company, but I don't really understand it. So what is geriatric care management? How does it fit in? When do you see a geriatric care manager?
Well, a care manager can be brought in at any time. So anytime there's a transition or a change in the status or care needs of an individual as they're aging, or if they're at a crossroads and they're not sure what direction to go, that's an appropriate time to be involved with a care manager. This is a professional who's an expert in aging, understands the medical arena, who can assess their needs and guide them to make the best choices for themselves. And if they can't make their own choices, that whoever is the power of attorney, the family member, so guide the family to make the best choices possible for good quality of life, maximum independence, and just optimal health care.
Okay, so do you work closely with their primary care physicians or the hospital discharge plan?
Yes.
How do you fit into the puzzle?
We can be brought in at any time. And depending on what the presenting problem is, that's where we're going to start. We can be ongoing because aging, as I like to say, aging is progressive. So what works today and for right now may not work in 6 months. It may not work in 2 years. We are always reevaluating what is working. Are they stable? Oops, now something's not right. Maybe they have some sort of physical ailment, a urinary tract infection, or their memory has changed. I had to throw that in there. We get a lot of calls from folks that mom was great, and then 2 weeks ago her memory just tanked. That's not a specific term. That she's just declined dramatically, and now we don't know what to do. Well, that's a great place for us to start.
Okay, and so when you get started with these folks that come to you and there's been a change, walk us through how you help them with that.
It depends what the circumstances are. Some people come to us and they just want an evaluation. I'm calling it a needs analysis because everybody does an assessment, and I don't want the client...
You mean a physical assessment?
I mean, any provider is going to come in and use the word assessment.
Right.
And it becomes confusing to the family and to the client. And then they'll say, well, I already did an assessment. Home health came here, or hospice came here, or the assisted living came here, and they did an assessment. And I always try to clarify, which is why I'm trying to not use that language. We want to look at the whole person, total picture, soup to nuts. What does this person need? Not what can I sell you, because I'm not providing any particular hands-on service. I'm going to coordinate all of the various players, all of the fragments that are now healthcare. So what do they need? How bad is the cognition? Where are they on the continuum? Is there a presenting problem that we need to address? Is it a crisis and we need to fix it today? Or are we just starting with the needs analysis? And it will go from there. And the family gets to decide what pieces they'd like to do.
Okay, so what I say every week is I try to keep it simple and keep it... I had a doctor on a recent show, and he started talking about all these really long syllable words, so I had to just stop and say, okay, here's how I hear it. So I'm going to tell you how I hear it today, because you're helping me, and hopefully we can help our audiences. You're almost like the general contractor.
Yep.
If you're going to buy a house or build a house, you got to figure out what kind of floor you want, what kind of drywall you want, what do you want the back deck to look like, what kind of materials do you need to use.
Well, and
what are your needs?
The inspector. We would be the inspector.
And the inspector. And so rather than going and calling someone who can lay the foundation or calling someone who can frame your house, you're going to go to the general contractor who is completely objective and listening to your needs and evaluating what your wants are, and then find the right person that's going to fit with matching those needs and wants together.
Good analogy.
Okay, great. So how does that... So you're then building relationships with the physicians and the folks at the hospital so that when people truly need that holistic needs and wants assessment, you're there to help them.
Yes.
So part of the uphill battle is getting the word out that we have these geriatric care managers
That's the struggle.
that are here for you. And the reason why this is so important, I'm thinking out loud here, Lisa, so tell me if I'm wrong, but our poor doctors today, really, with all the changes in healthcare, they have to see more and more and more patients every day. They really don't have the time that they need to practice the medicine that the way they used to. We're seeing a huge influx in retiring doctors because they can't practice medicine the way they're used to.
And they're not making,
and it's changing.
The PCPs, the primary care physicians, the internists, the general practitioners, are not making the money they once made. The Medicare laws are changing.
It's getting very difficult
January
to be
of
a
this
doctor.
year, the office visit will be shorter. They're going to have to rely on the rest of the team to implement things. But then that further creates the fragmentation that we're already seeing. So my view is that more people will need care management because somebody has to be the hub of information. Mm-hmm. Somebody has to know what's going on between the different physicians, mm-hmm. the specialist, the cardiologist, the nephrologist, the primary care physician, and then there's the physical therapist and the occupational therapist, and if they have a counselor, and is there a mental health issue, there's all these pieces, and then the family.
And Brandy's chomping at the bit. You've been awfully quiet, Brandy.
I'm typically chatty, but I'm just listening. I think an important piece is that also, beyond the physician, a lot of the education now provided to the senior care community, like you mentioned, is from a sales perspective. So people are getting such fragmented information. Mm-hmm. So they're thrown things like a new diagnosis like diabetes or congestive heart failure, new medications, and the doctor just says, do it, mm-hmm. take it. This is what you have, etc. And so families are walking away doing internet research, which is often very frightening. Mm-hmm. They're trying to put the pieces together. And often, when we deal with families, I take the phone calls now that come in. So I get the families when they're first in that panic, I think I need this and I have no idea. One of the things that I keep hearing over and over and over is, I'm sorry, I don't know this. I'm sorry, I feel like I should. And I told him, and I said, I'm going to be honest. I do this all day, every day. I've done this all day, every day for 10 years. That's the only way that I have any clue about this industry. And guess what? I learn something new every day. And so I think the relationships that we have built, I think I have probably the least amount of experience in this group at about 10 years. The neat part is we bring all that to the table, so we know companies that are better at certain things, physicians that are better at certain diagnostic testing and the way that they explain things to families and the way that they're looking at things. So I think that we can help become that hub, but also settle down the families because they're panicked and overwhelmed and they don't know how to prioritize, and the only information they're getting is sales.
Yeah, and see, okay, but I want to kind of reel back a little bit because I don't want people to be afraid of listening to a liaison from a home health or a hospice or whatever that has been brought in for you. But I often talk about how blessed I am because I get to be the host of this show and learn from other people's expertise every week. So my brain, because of the gift of my interviewees, mm-hmm. is able to see the big picture. And everyone I interview, I can see 4 other different sides of how that might apply to what it is that they're doing. And that truly is a blessing while I'm informing and educating people about living the best life they can possible. And that fills my heart. But when you have folks coming out to tell you about their product or their mm-hmm. service, they may not necessarily be selling you. They may be very passionate about what they can do for you. Mm-hmm. They're educating you about their piece of the puzzle. Mm-hmm. And you're educating me about how important your piece of the puzzle is right now, Lisa and Brandy. Mm-hmm. Because, again, I used to work in the financial industry. And we had stock mutual funds. We had bond mutual funds. We had balance funds that had both stock and bonds in it. And when people would ask me, what do you think I should invest in? I would say, here's the deal. He's an expert in growth stocks. He's an expert in small cap, small company stocks. This one's an expert in bonds. Mm-hmm. I don't ever promote buying a balanced fund because nobody can know everything about each part. Go to the person that's the expert. Mm-hmm. So what you all are doing is you have such a well-rounded background of all of the experts in every area, and you know enough pieces of the pie, of the puzzle, as I'm getting educated, and I do, to pull it together for these families and these patients so that they have the absolute best choices in every piece of their life that needs to be adjusted to live well.
Yeah, that's very succinct.
Okay.
Very well said.
Okay. So again, back to being the general contractor. You may not be the best bricklayer. You may not be the best drywaller, painter, but you're going to find the best.
That's correct.
But you need to make sure to go to the right contractor, because they might not have the best network.
Mm-hmm.
They may be helping out friends. Or they may be a little bit lazy because they've been around for a long time. They make enough money. They're not going to put enough time into it managing the other contractors they're having build your house. And this is what I want to get out about Lisa and Brandy. They are so detailed. They are so passionate. They are so compassionate and dedicated to doing the right thing for folks. I truly see you all as a huge benefit to the community here in Georgia, because you're going to turn over every rock and make sure that these people get what they need and the best of what they need. Okay, great. So I'm getting a better picture of geriatric care management. The other thing I like, I'm going to tell a story, and then I want you all to tell a story because this isn't my show and I'm talking too much. On past shows, for the usual listeners that are with me every week, you will remember this story. But my father had lung cancer. He was put because of a crisis in the ER in a hospital on Christmas Eve because of an abdominal issue. And while we were there, the doctor came up to me and said, well, yeah, he's going to be fine. We're going to get this under control. We're probably going to keep him overnight, but you really need to get that nodule on his lung looked at. At what point I looked up and said, what nodule on his lung are you talking about? Oh, the one from 10 months ago when he was here in the ER. And my heart sank, because I know what a nodule in a lung is. And I also know when you tell me it was 10 months ago that you discovered it and we've done nothing, I work in healthcare, and I know what that means. The problem is what you talked about, Lisa. These poor doctors, I don't necessarily blame the ER doctor. They are so busy and they are so pressured to get to the next one, get to the next one, get to the next one. And now we have all these new electronic medical record systems, but they're not all user-friendly, and they don't have time to get it all in there, and they don't have time in between patients to write it down so they can get it done right. My father's nodule was not communicated to his primary care physician or his family. And because of that, we lost him to lung cancer 5 years later. Folks, I tell you this story again because this is what I'm talking about, why I have geriatric care managers on my show today. These folks are going to be able to spend the time that they need with you because they are not under the pressures that the doctors are under or the ER physicians or the hospitals are under. And they can complete a very specific, detailed portfolio for you. And anytime anything in the future happens, this information is shared. Is that correct, Lisa?
That is correct.
So how do you work with the physicians? How does a patient work with you? Because they also, I think, have to take responsibility to make sure you know what's going on with them, so you can contact their doctor too to pull the piece of the puzzle together.
Well, absolutely. I mean, we have to have a medical consent form in this day of HIPAA and sensitive documents, confidentiality. We have to participate with all of those parameters, and so we do. So we have to get a consent form signed so that we can speak to the other providers. That's something that I require because it holds our hands. We're tied as to how far we can go and how far we can help. For many clients, we go to doctor's appointments with them,
Wow.
but it is not transportation. This is not home care. It's not a sitter getting you there. It's about advocating in the appointment.
And making sure every stone is unturned and communicated.
Yes, absolutely. And that's one of the biggest pieces that we provide is to make sure that the client is getting what they need in the doctor's office. The baby boomer generation asks the questions, but the silent generation before them didn't ask questions. They wanted to be good patients, which meant they shut up. Well, then they're not sharing their history. They're not sharing what's going on, and they just want to get out of there. And so they don't follow through. They don't get what they needed, and it was a waste of Medicare's dollars and everybody's time. So we want to make sure the physician really knows what's going on. We're going to ask for the appropriate prescriptions or home health script or DME or anything that the client, we think they might benefit from.
Okay, so we have limited time before we have to take a break here. Geriatric Care Managers, this show airs in Georgia and in Phoenix and the Gulf Coast and New Orleans and many other cities. You're located in Georgia.
Yeah.
But this is a specialty that the healthcare industry recognizes we need.
Would you like to know how to find somebody in those other places?
Before we go to break, thank you for leading me.
All right.
Can we, one, give people information on how they can get in touch with you in Georgia?
Yeah.
And two, for our other markets, what are good sites for them to go to find the resource that they need?
My favorite site, and we are very active members in the National Association of Professional Geriatric Care Managers, lovingly known as GCM. You can find them at caremanager.org. You put in zip code on their homepage. There's a little magnifying glass that says Find a Care Manager. You click on that, put the zip code in, and you can find a care manager up to 100 miles away from that zip code.
And that's www.caremanagers.org?
No S. Caremanager.
Caremanager.org. Okay.
And to talk with us, you can go to seniorcareopt.com. or 770-579-9177.
Okay, wonderful. Again, folks, that's 770-579-9177. And if you want to talk to Senior Care Options about geriatric care management for your loved one, yourself, someone you know, someone who may be in the hospital and they're just concerned, or they just came home from the hospital and say their head is spinning, they don't really know what they're supposed to do, that's the perfect time to call in a geriatric care manager, because they'll help you make sure you can manage the medication routine. They'll help you uncover if you need to follow up with a doctor, if you need other outside consulting services, and we want to keep you from getting back in that hospital in the next few weeks. So I see a huge need to reach out. Again, that's www.seniorcareopt.com, or you can call Lisa Meeks at 770-579-9177. Did I get that right, Lisa?
Yes. Thank you.
I can imagine that it's these folks that do come home from the hospital. It's just so overwhelming when you get there.
Well, the transitions of care is a huge issue, burning issue these days. And the thing that I find so interesting is they're recreating something that care managers have been doing for 25 years. Pulling in all of these different things, communicating across the lines, as it were, from one placement, from the hospital to the discharge to a skilled nursing facility to a discharge back home. All of those, we're able to cross all of those barriers. We don't work for any one of those companies. We work for the patient.
And collaboration and communication is so important in every aspect of your life. We have to take a quick break, but stay with us, and we'll be right back to talk much more in depth about geriatric care management. And with Lisa and Brandy, we're going to hear more from her. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thanks for staying with us. I'm Jeannie Pete, and just to remind you, in the first half hour of the show, we talked to Lisa Meeks and Brandy Hackett about Senior Care Options, which is a geriatric care management company. Their tagline is caring at a distance and staying connected. And we talked about how important that is to stay connected so that we can help you connect with all of the different care providers you have in your life. Again, geriatric care management is, I guess, not new, but a growing field in healthcare. And there's a great need for it because of the demands on our healthcare professionals, especially in the day and age of all the changes in healthcare that we're going through in this country. Doctors just don't have the time. Hospitals just don't have the time. we need somebody to be there for you and with you to connect the dots, to make sure that no stone is unturned, to make sure that communication and collaboration occurs between all the different doctors you're seeing and the different hospital personnel that sees you if you end up in the hospital, and so on and so forth. Home care, hospice, rehab, whatever it is that your needs are, things are missing. And the geriatric care manager can make sure that that entire puzzle is in place so that people can give you the best care possible.
Yep.
Right, Lisa?
Yes, I love it.
Did I do that all right?
You did great.
Okay, so stay tuned with us, because in this next half hour, we're going to talk about what I'm sure is on your mind. Okay, Jeannie, that's great, but how much is that going to hurt me financially? What's the cost of getting somebody like that in? Because there's really not a lot more left to go around. We're going to talk about certification and how important it is to ask the questions about how a geriatric care manager is certified so that you can choose the best one for you. And we're going to tell you stories to help you understand why this is such an important piece of your healthcare puzzle and why I am such an advocate of having Brandy and Lisa on this show today to educate and inform you, because I know it can help you live a better life. So, Lisa.
Yes.
Let's first talk about certification.
Okay.
What are some questions folks should ask when they're interviewing geriatric care managers to decide who might be best to take care of them?
Well, you want somebody qualified, credentialed, and certified. Caremanager.org, which is a website to find a care manager anywhere in the country. We have 2,000 members countrywide, and they have 4 different certifications that they allow in membership to be a qualified, certified care manager. One is Care Manager Certified, a CMC. One is Certified Case Manager, which is a CCM. And then there are 2 that are specific to social workers, having to do with case management, either an advanced if they're master's level or just certified social worker and case management. So those are the 4 accepted certifications through the National Association. So you want somebody who's been credentialed, their background has, their diploma has been checked. At one time they even checked transcripts, but they do a very thorough background investigation to make sure you have the education and the qualification to practice.
And why is that certification so important? What is that education that you're getting that is going to help you be a better geriatric care manager versus someone who might not have that credentialing?
A lot of it has to do with field experience, because that's a large portion of what they demand.
I love that. So they're making sure you actually have the hands-on, face-to-face
absolutely, that
expertise.
you know what you're talking. So you have to pass the exam, that you know what you're talking about, but you also have had the field experience. This is a great second career for a lot of healthcare professionals. But
it sounds like it. You can't just get in there.
You can't just get in there. There really is not a degreed program in care management at this time. There are certificates out there. Having a certificate is not the same thing. We have a blog on our website, and Brandy just did a piece on what is the difference between achieving a certificate, a piece of paper that said you completed a course, versus being certified, which is an exam that you sit for to show you have experience in the field. That's if you want to read the full thing, go onto the website and check out the blog. But it is important to have somebody who is experienced. I do serve in the National Association, and right now I'm both a point person for their certification committee, and I'm also I'm a certified fellow, and I field phone calls for people who want to enter the field, which I'm happy to do. Love to be a mentor.
And we need it.
I get phone calls from folks who have no experience in this field. I had a phone call from somebody this week who works at Coca-Cola, and she loves taking care. She took care of a family member, and she wants to now get into this. That's delightful, and I'm glad that she had a positive experience as a caregiver. However, that does not qualify her to take care of other people's family members, and she couldn't get liability insurance to cover doing that. So she has to go back to school, which is what I advised her.
And thank goodness.
Yeah.
We don't want, we want to make sure
this is serious stuff.
And you have to know an awful lot about an awful lot.
And if you can't get liability insurance to practice, then you don't want it. That's a question to ask as you're asking a care manager and learning about what they're doing. If you're thinking of hiring someone, you want to know about their experience, about their education, their credentialing, and do they have liability insurance? That's a very important thing.
I'm so glad we asked that We got that out there because that's going to make the difference between whether you have the right plan put in place for your future versus the wrong plan, because they're going to miss. Again, going back to the whole general contractor, they're not going to know enough about what questions to ask
Exactly.
the subcontractors that they're getting involved in your life, unless that's only something you can learn from experience and years and years and years in the business.
And a background in healthcare.
And a background in healthcare.
Yeah.
Okay, great. So cost. It's on my mind. I'm sure it's on everybody else's mind who's been listening today. Is there an additional cost for a geriatric care manager?
Yes, there is. This is a professional service like an attorney or a financial planner. An attorney would be your legal advisor. The financial planner is your financial advisor. Geriatric care managers can be your medical or your aging advisors. It is fee-based so that it remains objective. We don't get commission or kickbacks from any of the referrals that we make. It is against our code of ethics as professionals to do that. So it is fee-based to remain unbiased. The cost range in the Southeast region is about $90 to $150 an hour. And it just varies. It varies by the demographic area that the care manager serves and also by their years of experience.
And on average, how many hours would you spend if someone's trying to budget? I don't know if I can afford a geriatric care manager.
It's a question to ask the care manager because everybody runs their practice a little bit differently. I can tell you for Senior Care Options, our assessment we estimate at 10 hours or less. It is a lengthy, thoughtful process. You do get a report and a family meeting, which is part of the time that goes into that. So we try to tell people, expect at least 10 hours to have the needs analysis completed correctly. After that, we have a minimum. They can keep us on retainer for $250 a month, and they get a visit and a progress note. And that way they stay active in our system so that if a crisis occurs, we are ready in a moment's notice to start advocating on behalf of that client because we know them. If they go beyond a visit once a month, then we are not current and it doesn't serve the purpose.
Yeah, because, folks don't go to their doctor, but sometimes once a year.
Yeah.
And you really need to have your finger on what's going on with them.
Absolutely. Medications change, conditions change, memories change. We need to know how people are in a current way, and I won't compromise that. And we've had people who are like, well, couldn't we just do it once a quarter? No, it's a compromise of our integrity and our service, and I won't do that for the client. Now,
I'm going to take a minute here because that can be scary. I mean, you just basically said it's about $1,000 for the initial assessment and $250 a month after that. Mm-hmm. So I want to kind of make this real for all of you listening. They wouldn't be here if I didn't think it was an enormous service that can help you in your life tremendously. Because of my past experiences, look at my dad. If you think about $250 a month, if because of their comprehensive care, planning with you, and communication and collaboration with your healthcare team, whether it be your pulmonologist or your primary care physician or your home health company or whatever else, your rehabilitation physical therapist, if because of their collaboration and communication and commitment to you and their full report, they are able to keep you out of the hospital just once. If you go into the hospital and have an overnight stay, you could feasibly make up your monthly cost for at least 6 months, maybe a year, depending on your insurance, and that's going to get worse.
Easily.
And so I really want you to think big picture, not just, too much money, turn the channel, turn the station. Because in the big picture that I see all the time, people end up back in the hospital. Mm-hmm. People end up on a slew of different medications that maybe different doctors don't know that you're on, and you can be taken off some. So that $250 a month can come back to you tenfold by just taking care of this and having a geriatric care manager work for you. I didn't want people to be afraid.
Well, I can give a couple of other thoughts because I don't want them to be afraid either. We're here to help. And the initial cost sounds scary. But if you consider days lost at work, to go to all the doctor's appointments, and not being effective in the appointment because you don't know what you don't know. So there are repeat appointments. That's days off of work. I deal with lots of, they're mostly women, sorry guys, women who give up their jobs to become unpaid primary caregivers. There is a dollar sign that you can put towards that. And then there's the mistakes that get made in healthcare that end up being very costly.
Or a fall. I mean, my son, he just had wrist surgery to the tune of $2,000 out of mom's pocket. And then now I've got more physical therapy appointments coming up. But if you have an aging loved one who you're caring for, one fall, one hospitalization, well, there's thousands of dollars. I can tell you that right now because I just lived it, and that would pay for your geriatric care manager.
Absolutely.
Brandy.
I think the other piece is because we've been in the field, we know it. We're not only trying to avoid crisis, we're trying to be proactive. And being proactive in this field is not really normal. I mean, I've worked it long enough to know we are reactive in the way that we handle healthcare. You know, you get a cut, you go get a Band-Aid. You know, mom's confused, you throw her on a med, et cetera, et cetera. So everything is reacting to what presents. Where we come in, where it can always be a financial savings as well as a narrowing down the option of crisis, is we look at things like funeral planning, VA benefits that might be available, other options of funding that might be out there to help. And maybe they're with a company that is giving them recommendations that aren't sound. So we can say, you know, let's look at all the options, not just the option that's presented to you. And sometimes it's that plays into the cost savings. And I think that, you know, if you can take, for example, do something as tiny as the funeral home. And I speak because I've been there. I actually worked in this industry for about a year. And I can tell you the quote that was given to me, which continues to break my heart, is a funeral provider from a cemetery told me this: just remember it, Brandy, when the tears stop, the checkbook closes. And I sat there almost shaking because I was so angry with what I heard. And that's not, again, I'm not trying to generalize that everyone in the funeral industry is trying to get your money. But if you can think through things before the crisis, before the emotional reaction to things, people tend to spend less money.
You make better decisions, too. You just make better decisions when we are under a lot of stress. And in a crisis situation, it's proven we don't make good choices.
Well, and I see so many times these people, you know, our seniors, unnecessary tests, unnecessary procedures, unnecessary costs inhibited. And you're not someone who's going to be paid by scheduling this procedure.
No,
or this test or this lab.
Absolutely not. We are there to advocate. Does this test benefit this person? And if it doesn't make sense for this person, we will probably suggest that they think about not doing that. We want them to be judicious in how they're spending their money and their time. And we can also prevent overspending in other areas because folks don't know. We have lots of folks who have 24-hour care in their own home, and it's really outrageously expensive if you have 24-hour care. Well, then we might recommend living in an assisted living or a memory care unit because it would be a fraction of that. Mm-hmm. So we can also come and look at what are you spending for the care that's being provided, and is that the best way to use that money?
Yeah, and you know, I just interviewed a woman yesterday for a position with me, and she started out by talking about her mother, who she just moved in with and she's caring for, who has COPD, isn't on oxygen 24/7, has had a couple of ER visits, and she went for food stamps because she can't afford her care, and it was a terrible story. And I know hospice, and I said, well, did you know that she could probably qualify? And helped her through the scare of the word and why that could mean she could actually live longer. But what people don't know, too, is, you know, if hospice comes in for COPD, they're going to pay for everything related to the COPD. Correct. And so now you're going to have more income. Correct. And that's just one example because that's the world I knew.
The families don't know that. And hospice is an excellent example. We're really big supporters of hospice, and to be kind of early identifiers, if you will, of when people might qualify before a physician would maybe recommend it, and people are frightened, but it's a huge benefit, and it would pay for medications, incontinence supplies, medical equipment, and then to have some additional help brought into the home that Medicare covers all of that in a different bucket of money than the other Medicare, the parts A, B, and D.
And she said, why wouldn't my doctor say that? And I said, well, they're there. You see them to fix the problem. It's a very difficult conversation to have if they don't think you're at a place where you're willing to hear it. Some will push further. Some might wait for you. And in addition, I love physicians, and they're under a huge conflict right now because they're not able to do the work that they want to do, and it's out of their hands. So I'm an advocate for most doctors, but there are also doctors out there that understand that procedure, that surgery, that whatever test is going to help earn them money as well.
Correct.
And we don't really want to put that out there as a blanket statement, but there is a reality in everything in life.
That's
that
correct.
They also have to earn a living, and we're squeezing them at every single angle possible. And we're putting them in positions where continuing to do procedures also may be part of the decision. Let's just say that, part of the decision. And I love the idea that there's a patient advocate. And I would love to see, I don't know if you have these right now, statistics about the typical patient with this that you're helping versus the ones that don't choose geriatric care managers. And I can't wait for those statistics to come out to show length of life versus spending on procedures.
Right.
Because we've got to get that information out there.
And actually, the National Association is working on that right now. They're doing polls with the 2,000 members to gain data about their clients. Internally, we did a study on urinary tract infections, and
Brandy's favorite topic.
I know.
She asked, what you all don't know is before we came on the air the last time she was here, we had a very in-depth discussion about urinary tract infections and UTIs. So her opening statement before we got on air was, Jeannie, can we please not talk about UTIs today? So now Lisa has taken over for me and mentioned it twice. So we're going to continue to talk to you about urinary tract infections.
It's a very common thing that we see. A lot of times, persons with dementia, they're going to exhibit differently, and they don't have the traditional markers that people are looking for in a raised body temperature and physical complaints of pain, burning, and frequency.
They can't communicate.
They can't communicate it, and they don't remember it. So if they're not currently using the toilet, they don't remember that it hurt when they went to use the toilet. So they are not good historians. So what we look for is behavioral changes, and not everybody knows what to look for, and not to wait for it to become a crisis, and then it's a hospitalization. So we actually did a study of 35 of our clients 2 years ago. Out of 35 active clients, there were 17 reports of confirmed diagnosis of urinary tract infection and only 2 hospitalizations, which I think is awesome.
Yes, because normally someone recognizes that and boom, they send them right out.
The
to
assisted
hospital.
living would send them out every time. So that would have been 17 admissions, and we only had 2.
Wow.
And actually, of the 2, we caught them, but decided for other reasons to wait, and it turns out that really was what it was. We thought it was maybe some sort of, that it was a psychiatric issue, and it really was a urinary tract issue. So,
but okay,
we're here to
what you
prevent
just
and be
said-
proactive.
Yeah, and I like the idea that you waited to assess, to continue your assessment too, because sometimes people just jump to the decision and it isn't what it is. So you are truly treating the right thing for that patient.
Always.
Yes. That's
Looking for
fantastic.
the right cause for a change.
So let's talk about some specifics. I love stories. Have you got a story you can throw out there for our audiences so that they can visualize how you've helped make an impact in someone's life? I know Brandy has lots of stories.
Yeah. Here's one that I was kind of thinking about today. This is one of my first clients, and I learned a lot from him. This was a long time ago. He was young. He was 55, and he'd had a stroke when he was in his 40s. He was very heavy, and he was divorced and had 2 children that he was estranged from. So his only contact and the trustee for his trust was his sister who lived in Illinois. And so she couldn't come down here to take him to appointments and do all these things. And his sons were in their 20s, and they had their own lives, and they didn't want to be caregivers. And he really had his own behavioral issues. So I got involved. He was sort of like a hoarder, and his home was unsanitary. And I mean, truly, truly, I had to have him removed from, but he agreed. It wasn't, I didn't have to bring in the state or anything like that. He realized that there was a problem and wanted to get out but didn't know how. So we moved him to an assisted living where he got appropriate meals to follow his diet. He needed renal care, and he was afraid to go for the vascular surgeries. And with my support, he completed that. He had to have numerous over the remaining part of his life. But when I found him, he really was not thriving. And even though he was heavy, he was not doing well. And he lived an additional 4 years with the persistent advocacy and guidance that we gave him. And it allowed him to have a better relationship with his children and his sister. One of the ER visits I had, one of the nurses complained about his hygiene and actually said some very disparaging things. And I said, "You have no right to say that about him. This is a person, and he's getting the best care we can get for him that he will allow. And it's not okay for you to say that he has body odor or that he seems unclean and to be rude. He may have not been everyone's favorite person. He still deserved good care, and he got it."
But not only did you give him your advocacy so that he could live another 4 years and better than where he was at before you, but what I love most about this story is you gave his children and his sister an ample amount of time to have those conversations they needed to have peace, to be able to live their lives after he was gone. And we do that in hospice all the time, and that feeds my soul. I mean, that's why I do what I do, and I just love that has opened my eyes to the impact and importance of geriatric care management. So again, today, thank you so much, Lisa Meeks and Brandy Hackett, for joining me again today, Brandy, and for the first time, Lisa. Again, they are here with Senior Care Options, and they can be reached at 770-579-9177, or you can go to their website at www.seniorcareopt.com. I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead, and listen here same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.